Hi, I am going to talk about pelvic inflammatory disease. Definition: it is a progressive infection which causes inflammation and leads to detrimental damage of the woman's reproductive organs, usually caused by sexually transmitted infections, commonly gonorrhea and chlamydia. When the cervix becomes infected by an STI, it no longer prevents sterility but allows bacteria to invade the uterus, fallopian tubes, and ovaries.
The female reproductive system consists of the ovaries, fallopian tubes, uterus, and vagina. These organs are vulnerable to bacterial infections, which can be caused by poor hygiene or by sexually transmitted diseases. Are caused by bacteria that enter the vagina during sexual intercourse. These bacteria multiply in the warm, moist climate of the vagina, causing inflammation, pain, and vaginal discharge. Left untreated, bacterial vaginal infections can spread to other internal organs. For example, bacteria may enter the uterus through the cervix. If this occurs, bacteria can infect the fallopian tubes, where the bacteria can continue to multiply and create scar tissue. From the fallopian tubes, the infection can also spread to the ovaries, as well as to other abdominal structures, such as the bladder, intestines, and the walls of the pelvis. PID is the term used for the generalized infection of the uterine lining, fallopian tubes, and ovaries. Symptoms of PID can include vaginal discharge, chronic pelvic pain, and fever. However, the most severe consequence of chronic PID may occur during ovulation, when an egg is released from a woman's ovary. The scar tissue left by the bacterial infection may completely block the fallopian tubes, such that the egg cannot pass into the uterus. The result is either infertility, because sperm cannot reach the egg, or ectopic pregnancy, a medical emergency, in which the egg is fertilized and begins to grow within the fallopian tube. If you experience any of the symptoms of sexually transmitted diseases or PID, seek medical attention. Early detection and treatment is key to preventing unfortunate medical outcomes.
First discovery. Although there is no documentation for when pelvic inflammatory disease was first discovered, we can assume that it will be close to the same time or some years later that chlamydia and gonorrhea were found, as they are two leading causes.
It's infection of a woman's reproductive organs. Infection spreads upward from the cervix to the uterus, fallopian tubes, ovaries, and surrounding structures. Some of these conditions are also referred to as cervicitis, inflammation of the cervix, salpingitis, inflammation of the fallopian tubes, endometritis, inflammation present in the lining tissues of the uterus, and peritonitis, inflammation of the peritoneum, the membrane that lines the abdominal cavity and covers most of the abdominal organs. All of these conditions may be considered as specific diseases, but many investigators group them together as variations of PID, especially if they are caused by either chlamydia trachomatis or Neisseria gonorrhoeae. Bacteria can infect the fallopian tubes and cause inflammation, salpingitis. When this happens, normal tissue can become scarred and block the normal passage of an egg, causing
Some symptoms include fever, infertility, tissue scarring, abdominal pain, painful urination, painful intercourse, irregular menstrual bleeding, vaginal discharge with foul odor, tenderness in the pelvis, vomiting, no symptoms at all. When PID is caused by gonorrhea, symptoms appear immediately after menstruation, as opposed to any other time in the menstrual cycle.
One hint that women absolutely cannot ignore symptoms of pelvic pain, lower abdominal pain, if they have painful sex or irregular periods. These are your body just screaming to go to the doctor and get evaluated, because they can be signs of pelvic inflammatory disease, which is basically infection in the inside of your body. It infects your vaginal organs, and it's an ascending infection. So it starts in the vagina, it goes to the cervix, it can go into the uterus, go out to the tubes, into the ovaries, can actually cause abscesses called tubo-ovarian abscesses, which involve the ovaries and the fallopian tubes. These things can cause infertility. They can cause pelvic pain. They can cause pain with sex if they're not treated soon. The most often cause of the pelvic inflammatory disease is gonorrhea and chlamydia, sexually transmitted diseases, but it can also be caused by bacterial vaginosis. So even just normal bacterial infections can cause this as well.
Dr. Lisa, this is one of those, often it is sexually transmitted, but this is one of those where if treated early, very effective treatment.
You can cure it just with antibiotics, and sometimes it's out.
When PID is caused by chlamydia, bacteria minor to no symptoms appear even though the reproductive organs may be severely damaged. Diagnosis: there is no specific pelvic inflammatory test, but there are other tests used to make an accurate diagnosis. Tests include pelvic examination, throat ultrasound, C-reactive protein test, choledocentesis, WBC count test, laparoscopy, microscopic examination, culture of vaginal and cervical secretions, blood test, endometrial biopsy, physical examinations. Treatment: PID is curable with these treatments, but pose a higher percentage of recurrence in the woman if she has already had a case. 2 antibiotics are used together to eliminate the various bacteria that could be present. Treatment usually lasts 40 days, but varies depending on the type of infection and the antibiotic use.
Hi, I'm Dr. Rubina Shanawaz, consultant gynecologist at Motherhood Hospitals, Bangalore. PID is treated usually by oral antibiotics, which are decided after the culture is done, and we decide on the specific antibiotics, usually a long course of 2 weeks. If it is not subsiding or if the pain is very severe, then we do advise IV antibiotics, that is intravenous antibiotics. And if an abscess or some pus is walled out and collected, then we will need to do a laparoscopy and drain the abscess.
Antibiotics disadvantages. Some common side effects with all the antibiotics include diarrhea, nausea, vomiting, headaches, belly pain, cramps, dizziness. Conclusion: only found in women. The more sex partner one has, the greater risk of developing PID due to the immaturity of young adolescent cervix. Those aged under 25 are more likely to develop PID due to increased susceptibilities to STIs. Women who doge are at a higher risk, can cause infertility, can lead to death.